The psychoanalyst Ronald Britton wrote an excellent article on the concept of container-contained called Keeping Things in Mind. In this article, Britton implants two concepts, sanctuary and meaning, and puts them in parallel with the concepts of container-contained. Sanctuary is a type of container, meaning is a type of contained. Britton alleges that when a patient arrives at the clinic, he simultaneously seeks the container and the contained. That is, he seeks both sanctuary and meaning. The sanctuary is like an external envelope, like a hug, external containment in which it is possible to feel secure. It is somewhat similar to Winnicott's holding environment. Contrary to sanctuary, the meaning is the contained. It is internal. It is the feeling of being understood from within, sustained from within, that someone took all the things one said and connected them into a meaning. The theme of the meaning is parallel to the selected fact, something that generates a coherent gestalt from all the components of the session. From Britton's point of view, the patient who arrives at the clinic seeks containment both in the safety of the stay in the clinic and in being close to the therapist, but this is not enough. He is also looking for a therapist who can understand his internal world and hold him as if from the inside. If the outer shell is missing and there is no sense of safety, no sanctuary, the patient may feel left out, dropped, or feel like they're falling. This is one possibility, a fear of falling. On the contrary, if there is sanctuary but there is no meaning, it could be said that the therapist grants a lot of security and acceptance, but the patient doesn't feel understood, held, or supported from within. The patient may feel misunderstood and fragmented. One deficiency leads to the threat of falling, and the other to the threat of fragmentation.